Starting clinical placements can be both an exciting and daunting time. You may be wondering how you are to approach this style of learning, especially if you've had little or no real clinical experience in a hospital or GP setting. This video will therefore provide you with 5 key tips to ensure you can make the most of each hospital or GP placement you attend. If you have already started your clinical placements, then this video will still provide you with important information that you can apply straight away. And welcome back. If you're new, then a massive welcome to you. My name is Dr. Baptiste and I work as a portfolio GP, and currently I work in a completely remote role. If you want to know more about a portfolio career, then be sure to check out an earlier video here. If you want to be supported on your medical journey with videos about how to boost your CV, understanding your finances as a medic, and more, then hit that subscribe button. And as always, be sure to give the video a thumbs up if you enjoyed it. So let's get into the video. Tip number 1, understand your firm. Every firm or group of doctors on a placement will have their own way of doing things based on that specialty, and of course the way the team feels is best for the patients or system structures in place. Whilst there will be a general way of working across the board, there will be slight differences in each specialty, ward or firm. So this means you have to tailor how you contribute to the team and how to maximize your learning. For example, the ward round might start at slightly different times and there could be morning and afternoon board rounds. If you have a clear understanding of the routine, then it will be much easier to get to grips with what needs to be done, how you can help out, and the best way to learn, and quickly too. Tip number 2, show initiative. I've always valued a medical student who helped me, especially during the early years as a junior doctor. When I was just starting out myself, I really appreciated the support of the medical students attached to my firm. So here are 5 examples of how you can show initiative. 1, helping to prepare the ward round. This might involve helping to print out blood results or logging into a tablet for access to the patient's vital observations. This really helps the juniors, especially on a very busy ward with lots to do. Number 2, writing in the notes or typing. You may feel intimidated or worried about writing in the patient's notes, but once you know how to do it, i.e. you have some sort of structure in place, then it is easy. Ask the junior and senior doctors who will be able to show you how to get started. Number 3, attempting clinical procedures. I know you might be worried about failing, but honestly, this is the time to fail. It is better to fail at a cannula when you have an F1 who will be there to do it if you can't. When you're a doctor, there might be no one around to insert that cannula other than you. Use this time to hone in on your clinical skills. Number 4, speaking to colleagues, for example, helping with referrals, patients, perhaps to show empathy or update them about something, and relatives, of course, where this is all appropriate. Number 5, being the patient's advocate. A simple example, which I'm sure you all don't appreciate just how much it helps, is drawing the curtains for the patient's privacy. As we all know, it can be difficult to get any privacy on a hospital ward. Another example could be speaking up when something isn't right. Perhaps the patient doesn't want to be examined for the 10th time. Or perhaps the patient looks uncomfortable or upset when speaking to a healthcare professional. Number 3, know your stuff. The way to make the most out of every placement is to know your stuff. Try and get ahead by doing some reading or watching a few videos before the placement. When you sit in clinic, you can make notes about a particular condition or a management plan, and then you can read around it later. For example, you may be on a respiratory placement and see many patients with COPD every day on the ward or in clinic. It might seem overwhelming initially. However, one way to tackle all of this new information would be to focus on your history taking first, or read about one type of inhaler or COPD treatment and then build as you go. Number 4, network. Speak to as many people as possible. You will probably spend most of your time speaking to the doctors and nurses on the ward that you're attached or assigned to. However, do not forget about MDT or multidisciplinary team working. Speak to the pharmacists, physiotherapists, social workers, occupational therapists, and also staff that may not necessarily be on the wards, such as occupational health clinicians. With the latter career path, many people may not even consider it. By speaking to as many people as possible, you will understand all aspects to managing patients and better understand what they do, which will enable you to better fulfill your role as a future doctor. Number 5, a lot of waiting. On a final note, sometimes nothing happens. It's true, sometimes you may be sitting around for minutes to hours with nothing to do. Perhaps because the staff are busy or have forgotten you were due to have a teaching session at that time. Clinics get moved around or cancelled from time to time, or you may not be allowed in at times if the patient does not consent to you being there. This has happened a lot of times to my male peers when I was rotating in obstetrics and gynecology. So while you can't prevent this from happening, you might be able to prepare in some way. For example, if there are no suitable patients to speak to or examine on your ward, or the person due to teach you is not present and no one else can do the teaching session, then you might want to consider befriending doctors or nurses or allied healthcare professionals on another ward, or joining a peers teaching session or ward if allowed. You might want to bring some work with you or go to the hospital library. Now, of course, this is the last resort, I would say. Try and make the most of the hospital environment while you are there. Finally, don't worry if you're not grasping everything as quickly as you would like. Clinical skills take time. It takes many years to get to a place that you are happy with. And even then, when you are there, as you know, there will always be something more to learn. Be kind to yourself and most of all, enjoy the experience. As always, if that video was helpful to you, then let me know by hitting the like button. Share it with a colleague as well. I'll be continuing to support you on your medical career journey in the next one, so I'll see you then.